Hi, my name is Richard Isaacson. I'm director of the Alzheimer's Prevention Clinic at Weill Cornell Medicine and New York Presbyterian, and it's my great pleasure to be here with Maria Shriver, who's really inspiring change across not only all over the United States and all over the world, but also all over neurology waiting rooms. She's on the cover of Neurology Now, a publication of the American Academy of Neurology. Maria, tell me about all the amazing things you're doing and how and why are you inspiring change?
Well, I'm happy to be on the cover of Neurology Now. It was never a goal of mine, but I'm really happy that it's in so many waiting rooms because I'm really trying to get people to focus on their brain, and I'm trying to answer the question, why do women develop Alzheimer's at double the rate of men? And it's not just because women live longer, and I'm trying to get researchers and doctors and the public at large to focus on preventing Alzheimer's, understanding Alzheimer's, funding research into Alzheimer's, joining clinical trials, because having watched Alzheimer's up close, watching a man who had such a brilliant mind lose it, I want to prevent that experience for any other families. But I'm particularly interested in why women's brains seem to be afflicted with Alzheimer's at such a rapid rate. Is it hormonal? Is it stress related? Does it have anything to do with childbirth? Is it have to do with depression? And every time I've been asking questions, people go like, I don't know, and that's not acceptable to me anymore. So I've been trying to work with lots of different doctors and humanitarians and social change agents to get people focused on funding research, gender-based research, into this question. And I know you've been doing a lot at the Alzheimer's Prevention Clinic. What's the newest data that you're getting?
Yeah, so in the Alzheimer's Prevention Clinic, we actually published our first paper. It's a pilot, so it's an initial study of our first 36 patients that we've tracked longitudinally. And just in a real brief overview, in the Alzheimer's Prevention Clinic, we see people who are normal with no cognitive impairment that have a family history of Alzheimer's disease. We do an intake, we do a very comprehensive neurologic history. And
I did this.
And we learn the most from the history, okay? We learn about the family history, we learn about everything about the person. We then do cognitive testing. We set a cognitive baseline that's super important. We use cognitive testing, the NIH toolbox. We use a variety of other validated tests, very sensitive validated tests. And then we do a very comprehensive panel, a precision medicine panel, where we're looking at lipid function, we're looking at particle size of the lipids, we're looking at inflammatory markers, metabolic markers, not just hemoglobin A1C and fasting glucose, but a variety of other things like adiponectin. We look at nutritional markers. We look at so many things and we digest it. We look at the person's genetics. We take genetics and everything else into consideration, and we give a very specific 5-6 page personalized approach. And then what we do is we track compliance over time, and 6 months later we see how people did. And in this first study that we published just a month or so ago, we were actually able to show that in a small group of people, just 36 patients, we actually able to show improvements, not just stabilization, but improvements in cognitive function.
That's really important. You should pause on that, because improvements is a big word. Improvements in cognitive functioning. And many people, most people even a year or two ago thought that's impossible.
Yep. And even when we started the program 3 years ago, I wasn't sure this was possible.
So that's huge.
I'm very excited about it, but this initial study was 36 patients. We're really excited. We actually, upcoming at the Clinical Trials and Alzheimer's meeting, this coming up in December, and also at the Lancet Neurology Preclinical Neurodegenerative Disease Conference, meaning the first ever conference focused only on preclinical disease. We'll actually be presenting the next round of our data, 166 patients followed over 6 months with pre and post data. But and I'm really excited to present that, and we'll talk about that more. But for now, our initial published study showed that you can actually increase robust increases, significant increases in executive function and processing speed. However, we weren't able to move memory much at all. There was no change in memory over 6 months. So what this means is these are normal people. We're not expecting to see improvements. Ideally, we would expect to see stabilization. These are not practice effects because we do a variety of tests that are in somewhat resistant to practice effects, although that cannot be entirely excluded. Our patients are improving their brain health over time. And what we've also found is that we're learning the biomarkers that correlate with each of these changes. So for example, if you want to give a targeted approach to try to improve someone's executive function, and that person has problems with high cholesterol, not just high LDL, but inflammatory particles like small dense LDLP, ApoB. Those patients.
I think it would be really helpful if we don't have to say all those words. Just speak in plain English how someone can improve their brain and their processing and their executive functioning.
Well, in this clinic, it's complicated. We have the help from preventative cardiologists, nutritionists, myself, and we try to take a very comprehensive approach, treat these risk factors, and we're able to show now for the first time improvements in brain function.
Executive processing, right? Brain processing. So how important do you see the data on games, on learning new skills? What's the data on that?
So brand new study came out at the AAIC meeting, the Alzheimer's Association meeting in Toronto, that looked at a program called Brain HQ. Now Brain HQ is a program you have to pay for. I have nothing to disclose. I have no commercial.
I just did a story on this for the Today Show.
I have no commercial interest in any of this or anything, but this was a fascinating study, and basically 10 years ago they did a study where they randomized people to different types of brain activities and the brain games, basically a 5-week course, I believe. And it was 5 weeks of either processing speed games or other games, and basically what this study showed is that 10 years later, after this 5-week study completed, 10 years later, people that completed the processing speed games actually had a lower incidence of cognitive impairment.
That's super exciting.
Super exciting, and as well, it also showed they had less car accidents and a
Yes,
variety
I
of
thought
other
that
things.
was fascinating because the games actually make you broaden your sight, broaden the things that you look at on the game. So I think that all of this research, I think, is really exciting because it's basically telling all of us that our brains can continue to grow and that there are things we can do each and every day to strengthen our brains.
Yeah, and in medical school, I was not taught that you could do anything about, first of all, treating Alzheimer's as well as preventing Alzheimer's. But it's a new decade now. The new frontier of Alzheimer's treatment and prevention is precision medicine, and I'm really excited about where our field is going.
And also the fact that Alzheimer's is developing in your brain for 20 to 30 years, so it's important to get involved in this young. I think that's one of the things that I like to talk about when you talk about inspiring change, is that for young people to think about what they can do today so they don't end up with Alzheimer's, quote, tomorrow. So that's a really important new approach.
Yeah, and there's no magic pill, and you can't just take a magic vitamin or a supplement or a cholesterol medicine or anything like that. There's no one-size-fits-all approach. This is not an algorithm. I wish it was. The textbook on Alzheimer's prevention has not yet been written, but we are making progress. There's Alzheimer's prevention studies that are ongoing. I think we really reached a new frontier in Alzheimer's prevention.
And you're part of it.
2 thumbs up. Got 4 family members with this disease, so just like you, I understand we have to do something now.
Okay, great. Well, thank you for talking to me, and we want to inspire change now.